Cloudbridge is that they think it's two cancers. They think it's not related to WM, and they will do neck lymph node biopsy, which is a cool one. They're gonna put local anesthetic, and then they're gonna take the samples out. It will take 4 weeks time to get results. So the result they will give me is on 9th of March. I think it's delayed, especially if things are going worse situation. But they said anything, if you feel poorly and everything, we'll give you steroids then. We're talking about the ULCH when I went to on 10th of February 2026 with my mom this time. There's a lot of things that discussed. I was the last person to be seen, and they did apologize for a delay and everything, and I said that's okay. But she saw us like around 6 p.m. and it's fine. I said, because I know that was in good hands. She said, first of all, the lymph node biopsy should not take 4 weeks of the results to come, but they will try to push it. So they're gonna actually speak to the Cloudbridge and talk about how they're gonna solve this matter, because it is, she said, we don't want to get this lost in transition as well. It can get lost in transition, the biopsy results and everything. So they really want to get as soon as possible, like a protocol they need for 2 weeks, they said, right? But they did say the ULCH nurse specialists were going to contact me on Monday and ask about me, how did it go? Yes, I'm having anxiety of it tomorrow. That's why I have a dry mouth, by the way. This is how my anxiety looks like, dry mouth, feeling anxiety, can't sleep. I feel really disturbed, honestly. I really feel disturbed what she has mentioned. It's too much for me. I don't know. I cried. As long as I cried at the hospital, fine. Even my mom cried. It was just, we both were so upset, honestly. The fact that I took my mom with her this time inside the consultation room, I just had to let her know what we discussed. I have written everything in my notebook because I forget things easily. And she was aware that I wrote things, and she's like, if anything in from the list, I'm like, well, that's it. I actually did talk about Cloudbridge. I said, do I need to continue Cloudbridge? It will be the third time if I have to move somewhere. The main reason I moved 2 times the hospital was because of the staff, the team. Guys, especially when you're a cancer patient, you have to advocate yourself so much that when you know that your team is not listening to you and they are neglecting your symptoms, which is my case has happened. That's why I went to A&E, and I went in the right time. They say that's good that you advocate yourself, that you went in the right time, because if you went in the March, it would be too late for you. The fact that Allah saved my life, alhamdulillah. The second opinion said that we will give you more intense chemotherapy and treat you as a high-grade patient, because she thinks it is a high grade, unfortunately, where the lymph nodes is actually spread to my neck, underarm, in my glands, in my bones as well now, unfortunately, and in my spleen as well, which is over now 24 centimeter, because the PET CT scan result I actually showed her. She said I need to get like a visual image, and I was like, yeah, I couldn't get that because that's 3D. She said, don't worry, I will email them. So now they're going to talk with each other, which is good. And this is the team I was wanted to have. This is the team. So I'm grateful that I have second opinion since 2023. Yes, the Christie Hospital, the Greater Manchester M20 took 5 months time to refer me to second opinion Dr. Shirley Shaw at ULCH. I have to mention this now, and this is the reality about Christie Hospital that they do mention. They did apologize, but 5 months, come on. Please do dua for me that tomorrow is my lymph node biopsy in the neck core one. I hope it doesn't hurt too much. I hope it goes smoothly. I don't get hurt and get pain that much. Please do dua for me. I'm really scared of for tomorrow. That's why I got sleep. I'm so nervous, guys. I can't sleep because of that. Do dua that I can do the chemotherapy that they want me to do, and they were discussing about stem cell transplant from my cells. Second opinion also said if you didn't get R-CHOP, that was needed for you. A lot of people told me not to do R-CHOP chemotherapy. A lot of people told me not to chemotherapy, but they said if you didn't do it chemotherapy, you won't be alive. That's what she meant. Yeah, I want to be alive. I don't know what. First of all, I don't know why Allah has given me relapsed cancer, and that's high grade again. I'm annoyed with the side effects already. I'm already living with it, and it's overwhelming. And yes, now I get to know I have I'm anemia now, which just explains why I got so much headache. I got severe headache, guys. Again, I can't stand cold. My platelets are 97 now. This is a ticking bomb. Basically, the cancer is not waiting for me. They have to act now, guys. I see myself anyway having treatment at Cloudbridge because they said we can't do local. My sister was asking if they can do local, but that's not going to happen. A lot of you asked me to eat sour soup, but that's just promotion. this promotion because it can give you a neurological. I already have tingling effect as a neurological problem. It's not going to work for me. My body's different from your mother or from your other loved ones.